Malcolm was, oh, I'm sorry, born and raised near the west side of Cleveland. She's been a social worker since 1997. In May 2020, Larissa contracted COVID-19 in the course of her work as a therapist in a long-term care facility. She experienced panic, shame, and guilt during her recovery. And while she was in isolation, she didn't want anyone to know that she was infected with the virus. She has a mission to help other survivors by advocating for affordable, accessible mental health care. She wants to help others impacted by COVID-19 to prevent feeling stigmatized and alone. Larissa holds a Master in Social Science Administration and a Master in Positive Organization Development and Change, both from Case Western Reserve University. When she's not doing the things that I just mentioned, she loves to cuddle with her dogs Ace and Deuce while reading historical fiction. And as a native Clevelander, you can find her sitting by Lake Erie, listening to the waves crash on really stressful days. I'm sure that not today, because it's a little chilly out there. But thank you so much for joining us, Larissa.
Are we ready?
Oh, you're ready.
All right, you guys, are you ready? I'm gonna make sure I can share my screen here and find the right thing. And I've got to move this. I don't know what you see right now, but this I'm gonna just minimize that. Oh, that, and I've got to go back to the beginning. And so let's see, presenter view. And that didn't do what I wanted it to do. So this is all recording, and you get to close your eyes so you don't see all the slides. So thank you, Jocelyn, for the introduction. And I hope that my story can inspire other people. I am going to minimize this. And I let you guys know if you have any questions during the presentation, I don't mind. I actually like to interact with people and not feel like I am just talking to myself in the group. So the presentation is From Panic, Shame, and Guilt to Acceptance and Advocacy. It is my survivor journey in with COVID-19. So the first thing I want to review the objectives that were presented in the flyer, that were not flyer, but web page. So you're going to hear my story, which focuses mostly on the way that it impacted my mental health. And I'm going to detail my experience and share some of the physical symptoms that I had, especially about anosmia, which means that you can't smell anything, and exhaustion. That means that I was really tired, and how that contributed to my distress. And I messed up the bullet points on there, so you'll see that. You're going to learn how the experience can contribute to anxiety, not just for me, but for other people, but maybe not everybody, and get an understanding of the importance of how affordable and accessible mental health care can help you to accept a new identity. So first I'll start with something that you probably already know, but I feel like it's good to introduce a topic. So what is COVID-19? You probably know it from the news and seen stuff all the time, but COVID-19 is an illness that's caused by a novel coronavirus, which is actually named SARS-CoV-2. That was first identified in Wuhan, China in the fall of 2019. Novel means that it hasn't been previously identified, and the name is short for co is corona, v is virus, d is is disease, and 19 is the year that it was first identified. So what are viruses? Viruses are microscopic parasites that are generally much smaller than bacteria, and they lack the capacity to thrive and reproduce outside of a host body. Viruses exist almost everywhere on Earth, and they can infect animals, plants, fungi, and even bacteria can be affected by viruses. Viruses cause a lot of human diseases, which include smallpox, the common cold, and the different types of flu. Measles, mumps, rubella, chickenpox, and shingles are all caused by viruses, as are hepatitis, herpes, and cold sores, polio, rabies, Ebola, Henta fever, and SARS, severe acute respiratory syndrome. Dengue fever, Zika, and the Epstein-Barr, which causes mononucleosis, are all viruses. COVID-19 is believed to mainly spread person to person between people who are in close contact, which is about 6 feet from one another, through their respiratory droplets that are produced when they cough or sneeze, talk, or sing. It's also possible that a person can get COVID-19 by touching a surface or an object that already has the virus on it and then touching their own mouth, nose, or eyes. But they don't believe that that's the main way that the virus spreads. When I initially wrote this presentation, there were 7 million survivors in the United States, but now it looks like close to 14 million people have been infected with COVID-19 or the coronavirus and been diagnosed with COVID-19. There's a lot of focus on the number of people that die from the virus, which is an important metric, and the stories of people who have lost their life to the virus are very important to share. However, there's less focus on lasting effects on survivors, people who've had it. And, there's so many different presentations, from asymptomatic with no symptoms at all to being on a ventilator to dying from pneumonia or other complications of the virus. There's around 99 different symptoms that are reported. There's like commonly 10 or 12, cough and fever, fatigue, malaise, muscle aches and pains, and losing your sense of smell and taste. But there's other symptoms that there's just so many different ways that this virus can present itself in people. So how does this virus impact our mental health? Well, one, it impacts all of our mental health, whether we're infected with it or not. Of course, now my furnace is going off. Whether we're infected or not, by the collective trauma of the pandemic and changing the way that we live and move about in society, the economy struggling, people going through unemployment, people being afraid of getting it, afraid of their family members getting it, and what might happen, because it's such an unknown. You can have it and not have any symptoms, or you can have it and die. And there are some ideas about who gets worse outcomes, but some people have bad outcomes that didn't have pre-existing conditions that they knew of, or comorbidities. There's also complicated grief that impacts our mental health when someone dies, even if they die from another cause right now. Loved ones may not be able to be at the hospital with them, or they may not be able to visit them in a nursing home before their death, to say goodbye, to say the things that we need to say to our loved ones as they pass on, like, thank you, I forgive you, do you forgive me, I love you, goodbye. We don't get to say that. And then when we have common rituals that we celebrate, or not celebrate, well, to celebrate people's lives, to honor their lives, and those have been impacted by the number of people who can attend a funeral. Today I went to a viewing for my friend's mom passed away, and there's a big sign on the funeral home door, no more than 25 people permitted at a time, where in the past we may have large gatherings for our family members, or visitations that go on and more people are present and get to interact with people. That's a way that we honor people as they've passed on, and that's not allowed anymore. That's limited. So that complicates our grief. And for people who are infected with the virus, our mental health is impacted by isolation, panic, shame, guilt, feeling afraid, stigma. Maybe you're infected and you infect someone else and then they pass on. So that complicates the grief that you would have in this situation. So there's a lot of ways that COVID-19 impacts our lives, our mental health. So what's my story? It's kind of, I've already shared it a lot. And at first people told me not to share my story, that I should be ashamed, I guess, or, I might suffer stigma. And when I was originally infected with it, I didn't tell anyone besides my very close inner circle. But I feel like it's important to know how it impacts our mental health, and to not be ashamed when our mental health is impacted, because there's many ways that our mental health is impacted. And the more that we can share our stories of survival, our stories of coming on the other side of it, and what it's like to have a panic attack, people feel more comfortable sharing too. So we're not suffering in silence. But my story is this. I had a runny nose, right? It wasn't like a congested nose. It was a drippy, drippy, watery runny nose. And I'd been gardening. So I thought it was allergies. And I didn't really even consider that it was COVID-19. Although I will say that I posted on Facebook that day that I'll be glad when every sneeze doesn't make me think I have COVID-19. The truth was I did have COVID-19. I guess I thought it was funny, but I didn't think it could possibly be that. I'd been so careful about social distancing and hand washing. I had been careful about wearing masks before they were even suggested, because there was all the, and there still are, all of the mixed messages about how to be safe, whether you should wear a mask or not wear a mask, what does it really do? It was so confusing at that time. And even still now, it's confusing. So I had this runny nose, and then I cooked dinner, and I just started to feel not quite right. I told my husband, I just don't feel good. Something's wrong. I felt like a little bit dizzy and a little bit shaky. I felt achy, but I thought that was all just gardening. Gardening, out of shape gardening is causing me to feel achy and not quite right. Just it wasn't, that not quite right feeling. So I was working as a therapist in a long-term care facility, a nursing home. So, and I'm a social worker, doing the therapy in the nursing home as a contract, not as a job. I didn't work for the nursing facility. On my way to work, I was driving on I-90, and I got a text message, which I probably shouldn't share that I checked it. And it just was from the facility social worker. And it just simply said, we need to talk. And my first thought was, okay, all my notes are up to date. If you're a social worker, a counselor, that's usually a thought that enters your mind is what didn't I document that I should have? But everything, I couldn't think of anything that I had done wrong. So I call her right back. I still remember where I was. I was driving by Eddy Road on 90, headed west, and immediately called her back. And she told me that one of the residents had COVID-19 and was in the hospital for it. And my heart sank down to the bottom of the seat, because I knew I didn't feel right, but I didn't have a fever. I had been checking, and I didn't have any of the symptoms that in May were talked about as COVID-19 symptoms. The only symptoms that I had could be attributed easily to gardening and to allergies. So because I wasn't employed by the facility, the social worker wasn't sure how I would get the PPE. So what happened was, in the nursing home, we were wearing masks that were really not really, like, they weren't N95 masks. I think they were marketed as them, but they were kind of like fake N95 masks. So we were wearing those masks, but now that there was a resident that was positive and hospitalized, they changed the protocol. So we had to wear full protective gear, which included a gown and gloves and the visors. And she wasn't sure how I would get that PPE because of my status as a contractor. Would I have to pay for it? She was just like wondering out loud, what would I have to do? So we decided that I would come back the next day, which I had already decided that I probably had COVID-19. And I was like kind of like shaky, like, oh my gosh, I can't believe this. So I got off the freeway, got back on the freeway, headed back home. When I got home, I took my temperature. Now I had been taking my temperature the day before. I was kind of like in that nervous stage all the time. Since I did work for a nursing home, I took my temperature a lot. So when I got home, it was 100.4 degrees. And I went online. So I had this, because everything always happens in the most inconvenient time. My doctor had retired and I was assigned to a physician's assistant. I wasn't even sure how to access them. So I went through my health insurance, and my health insurance had telehealth for medical care. The doctor that I talked to was in another state. And I told him my symptoms. I told him about my fever. And I was like, what? Allergies can cause you to have a fever, right? And he says, no, allergies don't cause you to have a fever. And I'm like trying to convince him that allergies can cause a fever and it's only 100.4. But he was like, you're exposed to it. You have symptoms. Everybody thinks that it's gardening, that the body aches are moving your muscles in different ways. It's everywhere. It's very contagious. You have to get a test. But he didn't know how to get a test in Cleveland. So he was looking it up, and you could go to the Cleveland Clinic, but you had to have a doctor's order and you could do this. And so after I got off the line with him, I found a test at Rite Aid. So I made the appointment for Rite Aid's test the next day. So Monday was when I had the fever and I had been told about the resident being in the hospital for it. And then Tuesday, I had the appointment to go to Rite Aid to get the test. So I go to Rite Aid, and before I left for the test, I think the test appointment was 11:45 or something like that. I lost my sense of smell, and I lost my sense of smell like instantly. I don't remember a point where I could smell a little bit and then not smell at all. When I was like, this is so weird. I had bought some essential oils from this expensive, now I'm like, now that I'm like so broke, I'm like, I wasted all this money on all kinds of frivolous things. But I had bought some essential oils, and I was like, my first thought was, these essential oils are weak. They don't, so I could sort of smell it, but not completely. And then I tried to smell curry powder, and that was gone. There was no smell of curry. I couldn't detect the curry powder at all. And then I tried to smell essential oils that I had from the past that I knew were strong, and I couldn't smell them. And I tried to smell bleach. That I don't advise anyone to do that, because my nose burned. I probably killed some brain cells or something. I don't know what happens to you when you smell bleach. It burned my nose, but I couldn't detect the smell of the chlorine. Everything, all of that was gone. So I go for the test, and I'm kind of like crying like on the way there. And the test, I had to go to Parma, and I live in Euclid, so it was like a long drive. I go and I get the test, and then I'm waiting for the results. And the nursing home administrator, who never really even talked to me before, called me that night or afternoon, late afternoon. And because the social worker had told him that I was experiencing symptoms and concerned about it. And he said, because I'd gone to Rite Aid for the test, I had to get a test at Metro Health because of their contract with the Board of Health around nursing home employees who had been exposed. And because I had a test, I couldn't come back to work until I had a negative test, and that the Rite Aid test wouldn't count. So the Rite Aid test took several days to come back. I called Metro Health. I'm not a patient at Metro Health, but the COVID nurse, who at first was like, no, you can't do it here. You have to have a doctor here. She said, well, I'll let you talk to a doctor. So I talked to Dr. Magolius, who I know from another setting, and he was very kind. And he scheduled me to get the Metro Health test, which was the next day on Thursday. And so here's the difference. There's the Rite Aid test, you go, well, both of the tests, you go and you sit in your car, and that's where it's done. The Rite Aid one, they give you, it's like a Q-tip that's long, and you break it in half and put it in your nose yourself. I think you put it in your nose and then you break it in half. But whatever, it makes your eyes kind of sting, like you're gonna cry. And I felt like I was gonna sneeze, but I didn't sneeze. and you do it in both nostrils and they count, and then you put it in a test tube and put it in a, well, this is how it was in May. Who knows how it is now. You put it in a tray and then push the tray and then you drive off. And it takes a couple of days to come back. Well, actually, it takes several days to come back. The Metro Health test, though, is like they stuck a mascara brush in my brain through my nose. So the results of that test came back that day. And I like that evening. And I knew I had it because I had lost my sense of smell. That was right around the time, maybe a week after they the news had announced that losing your sense of smell was a symptom of COVID-19. And I oh gosh, so I got the results on the Thursday night, and I already knew it was, in a way I sort of felt relieved because the few people that told me that I told rather were like, oh, you don't have it. And I'm like, I got it, I'm pretty sure. And it's almost like I'm like, okay, good. Now I can show you I do have it, because you're like, no, you're just paranoid. You just, no, I think I have it. So, but I was also scared about what was going to happen next. So I call this slide the couch. And that is not my couch. That's a couch that I found a picture of online. Maybe I find a better couch picture, but that's a nice couch, I guess. Anyway, the day after I got my results, so I got my results on Thursday around 6:00 in the evening. And on Friday, the resident that I contracted COVID-19 from died. And people will say, well, she was a nursing home resident. Well, that's the thing, people don't, when you say, well, someone died, or they had these pre-existing conditions, or this, and of course, she was a nursing home resident, but she wasn't dying, and she wasn't that old. She'd been a nursing home resident for a lot of her life in different facilities, but she still had a life left, and she enjoyed her life in the nursing home. She wasn't, had dementia. She wasn't miserable there. She'd found ways to enjoy life. And anyway, I was very distraught that she passed away, and knowing that I got it from her contributed to my fear she didn't survive. So I couldn't stop crying. My thoughts spiraled like to despair and panic. I couldn't catch my breath. I had real live panic attacks that were very severe. And I convinced myself that I died. And I convinced myself that I killed off other people. And even though I was like so careful and hadn't really been around people, the thought that you have something that can kill other people really is terrifying. And I had been around my brother from the last time I saw that resident, and when I got symptoms, and I know you can pass it asymptomatically. So I was so worried that he was going to catch it. And I was like consumed with guilt about that. Thinking I had another friend I met on the Friday. So I met on Friday before I had symptoms. We called it social distancing coffee, where we met at Starbucks and sat in our cars, and we sat more than 6 feet away, but it was still just the thought that maybe I gave it to her. And I told her that I had it. She was one of the people who were like, you're probably okay. But then she started to worry that she got it too. So I felt so bad for even scaring her, because she didn't catch it, but I didn't want her to have it and not notify her. And then, like I said, in my mind, I thought maybe I gave it to my brother. And if my brother gave it to his tenant who has lots of health conditions, I had really killed off the whole west side of Cleveland in my mind, which is so scary. So the reason I have this as the couch, for 2 weeks, I sobbed on the couch. I felt ashamed. I didn't want people to know. I felt guilty. My whole body really shook and trembled. I worried that it would get worse. I learned a new word the other day from a client called, the word is doom scrolling. And I did that. So doom scrolling means you just like look on your phone, scroll on your phone, and read negative stories, negative news stories that scare you. So I doom scrolled for 2 weeks, really. Well, maybe not the whole 2 weeks, but I read stories about people who were young and healthy, especially a nurse who was young and healthy. She lost her sense of smell and then she had a stroke and died. So every day I thought it would get worse. And one of the things, I moderate a support group on Facebook for survivors of COVID-19. One of the things that people will call it, they call it the Advent calendar. So every day it feels like there's a different symptom. So one day I have a runny nose and then the runny nose is gone. And I had a fever, but the fever would go up and down, up and down. My fingertips were numb. I was extremely thirsty, like parched. Like I felt like the desert was in my mouth and I couldn't drink enough water. My fingertips were numb. My ears were buzzing, ringing, buzzing, like the buzzing of a broken record, hissing kind of that broken record. So if you're young, you probably don't know what a broken record sounds like, or what the fuzz of a record sounds like. But that was in my ears for a long time. My doctor, the doctor that was assigned to me, prescribed Xanax for me because I was having such severe panic attacks. And that helped. And at first I thought I was really afraid to take Xanax because I didn't want to get addicted to it. I don't know, like that would just add to my problems, right? Like I've got this problem, then I'm addicted to benzos. That's just great. But so at first I didn't take it like every 12 hours like I was supposed to. I only took it when I felt a panic attack coming on. And that's really not how you're supposed to do it. So then I started to take it every 12 hours. One day, while I was in isolation, a guy came to the house to sell pest control. And he was so persistent. I had the door, because it was like the middle of May, and the door was open, the screen to get fresh air. Not that I could smell my lilac or anything anyway, but I told him to go away. And he's like, no, I just want to talk to you for a minute. And I'm like, no, go away. And then I had a panic attack. Like I could have killed this guy. I could have given him COVID-19. And what is he doing walking around knocking on my neighbors' doors? Because where I live, a lot of my neighbors are elderly. And I'm like, why is he could be spreading it? It was so crazy. I called the police, but I guess he was okay to do it. But it freaked me out so bad. So the doctor prescribed me Xanax, and then this really comes later, but I'll say it now. It was my PCP. She gave me 1 month of it, and when the month was over, and really the month was over plus a couple of days because I was at first not taking it every 12 hours. I called back for a refill, and she said, "No, I'm not giving you anymore." Or the nurse told me, "No, you that's it." Eventually, when I finally got to see a psychiatrist, the psychiatrist told me that's really not how it's supposed to happen. You're supposed to wean off of Xanax, not just like have it and then cold turkey, now you don't have anymore. So that contributed to anxiety. Another thing that there's like medical, what's the word? I don't have it in my notes, the actual word, but medical gaslighting. And so I wasn't able to see a doctor until August. So I had it in May, but they wouldn't see me until I could produce a negative test. And I tested several times. So I tested positive from May until July. Even though I was better, but still fatigued, I couldn't see a doctor face to face. And I have, like, my heart is racing. Now I'm generally a nice person, not always. I'm not always a nice person, but I had got an appointment with a cardiologist, and the nurse called to cancel. And I was like, it's like I'm not even, swear word, human anymore, because it's like nobody cares that I'm not well, and it's like when you're in isolation or when you have COVID-19, at least in May, and what I still see on the support group, you're either in the hospital and very, very ill, or you're on your own to be by yourself, not go around people. That's the medical care. Just don't give it to anybody else. Take Tylenol for pain. They don't even tell you like things that people suggest on the support group to take like more vitamin D or vitamin C or whatever, to help clear your system or build up your immunity. The care is really, don't give it to anybody else. So I didn't want anybody to know that I had it. My brother knew, a couple of my close friends knew. Interestingly, a person that is more of an acquaintance than a friend, but she supported me a lot because I know she lived close by and I knew she was working from home. She's the person that I trusted to go pick up the Xanax. So I was like, can you help me? Because they won't ship it because it's a controlled substance, but I can't leave the house because I have COVID-19 and I need to get this prescription filled. So she went and picked it up and left it on my porch, picked up groceries. It's not funny, but when I went into isolation, which was on the Monday that I was knew I had been exposed to it, I needed everything from the store. And we had food and stuff, but my friend Felicia went and picked up all kinds of stuff from Marks and Target and everywhere that I needed. So I'm so thankful to her. She supported me a lot. And that was very helpful. But I was afraid for a lot of things. I didn't want to be vilified. I didn't want people to think that I hadn't been careful because I had been so careful. I didn't want people to know about the anxiety I was experiencing. I was ashamed of that. And I also didn't want to be pitied. Like, I don't want people to feel sorry for me. But I had this horrible disease, I felt, that could kill people. And I had convinced myself, I think I said earlier, that I was gonna die because every day was different. And I never had like the cough. My fever never went that high, but I had this really high heart rate. My feet sometimes felt like they were on fire. I had a lot of neurological symptoms. I felt confused. I felt brain fog was a problem. One day, I called my little brother and I said, if I die, will you take care of my dogs? I have a picture of my dog because he's so cute. So here's Ace. That's Ace, my beagle. Well, I think I gave it to him too because he was coughing one day and very lethargic and tired. But he was my support. He cuddled with me the whole time I was sick, and he wasn't that great of shape either. But I called my brother and I'm like, when I die, will you please take care of Ace? And he's like, you're not gonna die. And I said, but you don't know that. I think I'm gonna die. But I was really worried about the future for Ace. And I explored my life and bad decisions I made and mistakes I made and times I wasn't the best to me and all of that stuff while I was laying on the couch with Ace cuddling. So what's it like to lose your sense of smell? It's not like having a cold where you can't smell things because you're congested and clogged up. It's really different than that. And one of my friends on social media, or a friend of mine who is on social media, was posting jokes about not being able to smell stuff. And I got so angry because it's not funny at all. So the temporary loss of smell is called anosmia. And it is the main neurological symptom of COVID-19. And it's one of the earliest symptoms that people get. So I told you, my nose was runny on Sunday. I probably wouldn't have even known that I was infected until Tuesday when I lost my sense of smell. But I knew that I had a confirmed contact that was in the hospital. So it's one of the most commonly reported indicators of COVID-19. People don't generally lose their sense of smell completely unless they like get hit in the head or have some other kind of neurological damage. Some other viruses may impact that, but it's really a common symptom for COVID-19. And it's not, everybody doesn't get it. I think I maybe didn't say this in the beginning. This is my story. There's 14 million stories. Every presentation of COVID-19 is different. So maybe everybody doesn't have panic attacks. Maybe everybody doesn't lose their sense of smell. Everybody doesn't cough. Some people have stomach issues. I didn't have that, but lots of people report that. So your sense of smell is taken for granted. And our memories are stored in our sense of smell. So this year, I didn't get to smell my lilac. And my lilac reminds me of my grandmother because she had a lilac. And I remember the springtime and their lilac. And when I planted this lilac and in memory of her, and I smell it and it just takes me right back there. But when you can't smell things, that you don't have that. Enjoyment of life and memories are impacted by your sense of smell. Also, I couldn't taste anything except for the basic taste, like salty, sweet, bitter, sour. I could taste those, but not the flavor of something, if that makes sense. So also, it whets your appetite. So luckily I could stand to lose a few pounds because I didn't really eat. Even if I was hungry, it wasn't right. So our sense of smell also serves as a warning system about dangers like spoiled food or fire or hazardous chemicals. If you can't smell, then you can't smell those things either. So when people lose their sense of smell or is altered or absent, pleasure, you feel isolated around, but for me, I lost my sense of smell for about 2 weeks. Other people lose it longer. Some people lose it less. I would drink coffee in the morning. It tasted like bitter hot water. One day the dog pooped on the floor and I didn't even smell it. I'm just sitting in the room with the dog poop like, hey. One of the first thing that I smelled was soap, hand soap, a Bath and Body Works hand soap. I couldn't smell the fragrance of it. Those are highly fragrant, but I could tell it was soap. And then one day I had opened the refrigerator and there was spoiled salad. The salad that's left in the box when you, not box, bag, when you like eat half of it or 3/4 of it and you have a little bit less left. That was, I was very happy that I could smell that gross spoiled salad. A lot of my food spoiled during that time because I didn't cook. One, I didn't have energy to cook, but two, I didn't have any desire to eat. The other thing for me was fatigue. The fatigue was bone crushing exhaustion. And that lasted for a really long time. Even after I was better, I or didn't have, like, I could smell things and I was out of isolation and I tested negative. I still felt fatigued. I think I'm still not 100% not fatigued, but it's a lot better than it was. After I had a negative test, I went to the vintage home days with a friend of mine and bought myself special presents to celebrate that I hadn't died. And just going to that for a few hours, walking around, I was knocked out for 2 days after that. It was just that any kind of thing. So fatigue, I had to learn, and people who have chronic fatigue will tell you, you have to learn to pace yourself because you have so much energy you can expend. And even if it seems like you're okay, if you overdo it, then you're back, knocked out for a couple of days. So I finally got to have counseling, and I told you my doctor prescribed the Xanax, then wouldn't give me any more. The psychiatrist that I ended up seeing, a psychiatrist, gave me something else for anxiety, and then weaned me off of that. So I also had telephone counseling with a therapist who helped me put things in perspective. Remember, I said I felt so guilty and ashamed. I didn't want people to know, and I was just guilty. And one thing that she said that really helped me put things in perspective was, would you feel guilty and ashamed if you had caught a cold? If you caught a cold, would you feel this way? And I said, no. And she was like, well, then this is so much more contagious than even a cold, and you were being careful. And that just helped me. I don't know why that one statement helped me, or one question, would you feel ashamed about catching a cold? And of course I wouldn't, would really helped me. That was probably the best question. So one of the things that was was about identities. So this is like, in general, all of us have identities. And what happens when an identity, a big identity as a healthy person, it changes, and it changes suddenly. So now I have this identity as a COVID-19 survivor, although I don't always like that particular word because I don't feel like I earned that. I didn't go to the hospital. I didn't have pneumonia. I wasn't on a ventilator. My suffering was mostly laying on the couch, feeling sorry for myself, laying on the couch, having panic attacks. But it still is a new identity and a new thing to incorporate into who I am as a person. It's been life-changing for me. I have a shoebox full of medicine that I never had before, just like my grandparents. And I would laugh, like, now I've got this shoebox with medicine. I also, though, feel like I've, had the exhaustion for a long time. I've had anxiety and tachycardia, and I had to slowly taper off of the benzos after I had the Xanax that got discontinued fast. But I also, maybe thinking that I was gonna die gave me a new vision and mission. I feel braver. I feel like I have better boundaries than I did before. I was able to start my own practice. So I have my own private practice now, and I'm doing these trainings to advocate for mental health care for all of us, not just COVID-19 survivors, but everyone. I'm so blessed to have health insurance that covers mental health care. And so I was able to incorporate my new identity into who I am and accept it and try to advocate for others. I don't know what would have been had I not had a therapist to say, would you feel this way if you had a cold? Because after that, I started to share my story with others. And as I shared my story with others, people who thought they might have caught COVID-19 or were feeling different ways call me for support because I know what's going on. And they have, the ones that have contacted me have felt the same way about not wanting people to know or having panic attacks and being ashamed of that feeling. And that's not, we don't need to be ashamed of what's going on in our brains. So it has changed my life in some ways for the worse because of this shoebox full of medicine, and in some ways for the better because I'm able to incorporate my new identity through the help that I got through mental health care. So my timer says that that's 40 minutes. So here's a slide that says discussion. Does anyone have any questions or comments? Should I stop the share, Joycelyn?
Sure.
Okay, unless you guys like the picture that I found of people talking. I could keep on talking if you want. We've got 15 minutes left.
So I wanted to ask, I'm sorry, the shoebox of medicine, how long is that? Or is that, I mean, that's what you took or what you're still?
No, that's what I'm taking. So COVID-19, and I will just be honest and tell you that the doctor might say I'm overweight and I probably need to lose a few pounds, but I have high blood pressure now. So I'm taking 2 high blood pressure medicines, lisinopril and amlodipine. And at first that's why the one was added, was that the first high blood pressure medicine wasn't working. My blood pressure was like 154 over 100. And my pulse is still high. And I also was left with pre-diabetes. Not, and like I said, I'm overweight. So doctors always blame everything on that. But I had a physical in January and I caught COVID-19 in May. In January, I didn't have high blood pressure. And in January, I didn't have diabetes. So I also, so I'm taking metformin and I'm taking my make sure that it's not too high. And I'll say also, I forgot about that. Which I'm a woman of a certain age. So I started having terrible, horrible hot flashes, which also comes with COVID-19, but it also comes with menopause. I wasn't in menopause before, but I am now. So I have a patch of estrogen patch. So I told you I have 2 high blood pressure medicines, a diabetes medicine, a blood pressure, estrogen patch, and what's the thing that, so you take the estrogen and the progesterone. So I take a progesterone to go with the estrogen to stop the hot flashes. And I'm taking, I was taking Klonopin, but that I tapered off of that. So the doctor, the physician's assistant gave me Xanax and then discontinued it. And then the psychiatrist gave me Klonopin and the generic, I don't even know, was it Celexa or Lexapro? Whichever one is the newer one, I think it's Lexapro. I don't know, escitalopram. So I was tapered off of the anxiety, the benzo, and now I'm taking an SSRI, which I don't know if I'll have to take that forever. I don't know if I have to take any of it forever, but yeah. So I got like, on Sunday nights, I take my little shoebox with all the medicine and I put, because otherwise sometimes I forget. I have to put all the medicine in the once a week, the once a day thing, and remember to take it. I also take on my own vitamin D, because I would recommend this. And I'm not a doctor, so you didn't hear medical advice from me outside of my scope of practice. But there is research that says that low vitamin D levels increase the capacity, increase your chance of getting cytokine storms, which is the bad things that happen, one of the bad things that happen with COVID-19. So if you haven't had your vitamin D level checked, ask the doctor to check it and see if you need to supplement. We live in northeastern Ohio. We don't get a lot of sun. And if you haven't had COVID-19 already and you get it, your but like I said, I'm not a doctor, but the research that I've read said that vitamin D really can help prevent some of the worst things. So I take vitamin D, I take a multivitamin. I was never good about that before, but I did start like before COVID came. Well, when we started to know that it was coming, I had started to take more vitamin C and vitamin D and all of that stuff. So I think that answers the shoebox full of medicine question.
Yeah, good. Thank you.
You're welcome. Did anyone else? I see some questions in the chat. Maybe I should look. Okay, so someone said, did anyone around me blame me for catching COVID in any way to make me feel even more guilty? No. Nobody around me blamed me for catching it. No one around me guilted me or stigmatized me. But people, like I said, when I said I was going to start sharing my story, people suggested that I didn't. But that is, okay, that is a problem that I see people, like I told you, I moderate a support group on Facebook, and I see some people will like screenshot text messages that they get from their family members. And it's so devastating to see that, because people will say the meanest things to people about having COVID-19. I will say I was blessed. Nobody treated me badly about it. Nobody tried to shame or blame me for it. I did it myself. I shamed myself and blamed myself and felt guilty myself. I thought that, what did I do? Why was I working in a nursing home? I'm not right now, but like I knew the danger of that, but I just didn't feel, because the, I don't know, I guess I thought I was invincible and I didn't consider it. But yes, other people, I've seen people whose family members ostracize them. And I see people, it's like so much that goes on. If you would read some of these text messages that people send to others, it is just horrible. So let's see the other question. There was something else. Oh gosh, there's a couple of things. The average review for candle scents had dropped. Oh, that's really interesting. The average review for candle scents dropped to one or more stores because they said there was no scent for the candles. That is so interesting. There's there's a website, Absent, ABSCENT. I think Joycelyn is going to send you a handout that I created about COVID-19 and mental health, which I would love your feedback on it. If there's anything that you think I should add to it or change about it, I would love that, because it's fresh hot off the Canva. But the Absent website, for anybody who loses their sense of smell, I did that, and they've got like 4 essential oils that you can smell. And I would say prepare for that. Also prepare for potentially getting it by having some food, because if you get COVID-19, you're stuck in the house for 2 weeks. I mean, and especially another thing I see on the support group is people who don't have someone to give them food, to bring things to their home, and you can't leave. You're stuck in your house. So the being stuck in your house means that, you know, you have to be prepared with food and the things that you need. A pulse oximeter, unfortunately, they're very expensive now. They used to be very much cheaper, but have one, because your pulse ox can go down and you don't even know that it's so low. Like, I have a friend who was recently hospitalized and her pulse ox was in the 70s. That's when she went to the hospital. If it drops below 90, that's an emergency. So how else would you know? Because people's oxygen saturation drops really low and they're not aware of it. So that's just a thing to try to have, just in case, just like you have a thermometer, have that at home. Like I said, unfortunately, they used to be $10 and now they're probably 30. But if you can get one, get one.
50.
50, Marianne? That's my friend Marianne.
Yes.
They shouldn't be 50, but
I just got one.
well, you probably got the best one.
No, I got the CVS brand.
I still had a pulse. Here's an interesting thing. I thought when my mom passed away, she had hospice and we had a pulse ox for her. And I used that while I was sick, which my oxygen saturation was always good, but my pulse was high. But it was like a connection to my mom because I had this for her. And almost like she gave it to me because she really didn't need it as much. I mean, I'm taking her pulse ox, but she's on hospice, so whatever. Okay, so let me see what some of the other messages are. Did I feel guilty? No, I already answered that. Could I talk a little bit about how I was inspired to go after my dreams and take risks on new projects after my experience surviving COVID? Yes, I can. So laying on the couch, thinking I was gonna die, I looked at my life and I think I told you, I looked at mistakes I made. I looked at things I haven't done yet. Everybody, you know that song by Tim McGraw, Live Like You're Dying? That's a real thing. When you think you're dying, your change your life, whether you think you're dying from COVID-19 or you think you might die from some other thing, it's a life altering thing. So I had decided that I wasn't going to go back to the nursing home. I haven't talked a lot about that. That's their story, but my story is that I made a decision that I didn't want to do that anymore. I miss the residents, and it's not that I didn't want to take care of them and help them with their mental health, but it just, I felt like it wasn't right for me. So I have to work, right? So I started looking for jobs, but none of the jobs that I was looking for appealed to me. None of them felt like what I wanted to do with my life. And I also was exhausted all the time. Like that's sort of an exaggeration, but I didn't have enough energy. So when I thought about working for 8 hours and I thought about waking up, I segue a lot, so sorry if I'm distracting, but one of my other friends told me this too. So I have a sample size of 2, but I wake up at like 3 o'clock in the morning. That's like your COVID time. And my other friend has the same thing. Like I said, I don't know if there's research on it, but I get up at 3 and then I go back to sleep. But like every night I have that. So I, especially now, not as much. And maybe like, there's so many different things. Is it the Klonopin that was causing it? Is it, what? But I would have to take a nap every day. And so thinking about getting up, being on time for a job, getting dressed, driving to the job, even just the thought of it made me more exhausted than, just like, oh, I just can't. And so I woke up one morning at 3 or 4, somewhere between 3 and 4 probably, and had this idea, like, I'm providing therapy. I have an LISW. I have a master's in social work and a master's in organizational development. Why am I working for someone else? Because I was working as a contractor for someone else. So they would pay me a rate, but they were billing insurance at a much higher rate than what they were paying me. And I'm like, well, why can't I start my own practice? I've got everything I need. And what's the hesitancy about that? And I wasn't sure if I could do it, but that morning that I woke up, I filed for an LLC. I got an EIN number and I opened up a business bank account. Like that morning, boom, done. I already had, for those of you that are not in social work, you may not know about this. I had a CAQH already filled out, which is the credentialing for providers that most insurance companies go into this. I don't even know what CAQH stands for, but this, you have to like put all of your credentials and your licensure and your insurance. So I got the LLC, I updated my insurance, and I did all of that. So that was why I just decided I wasn't gonna give half of my income to someone else I can do it just as well. And now with the pandemic, one of the reasons I probably never started my own practice before is that there were a lot of expenses associated with starting a private practice. You had to have an office, and you had to have furniture in the office, and you had to have insurance for the office, and all of those expenses are gone for now. As long as telehealth stays, I right here where I'm sitting can provide therapy. And I was a little hesitant about the efficacy of telehealth for mental health care when I started doing it, but I have now, I've started the process in July, and I had to get credentialed through all of the insurance companies, even though I have all my stuff was up to date. That's still a process. But I think I have about 16 clients now that I see on telehealth, and there's only one that I really wish I could see face to face, which is a younger, and maybe I'm thinking I worked with kids most of my career, but I probably needed to take a class on telehealth with children, because I haven't taken that as a training, and it's a little bit different, a little bit harder to engage her on the video, which she uses the phone and then it's like pointed at the ceiling, and I'm not sure about that one, but the rest of them have been good. And so I'm building up my practice. So that was what I was just going to do, the private practice online. It's 8:00. I can keep on going. I don't know if you guys want to end. I just wanted to let you know, I'll go as long as I can answer all the questions. One day I saw an ad for, not an ad, but an ad on a Facebook group for social workers in my community. And they are off, or at, like, it was a call for presenters to do trainings. And at that time, I hadn't seen any trainings about the intersection of mental health and COVID-19. But now they're coming out. But in that moment, which was like August or September, probably September, I was like, let me help you by training, like just sharing my story as not necessarily a whole thing. And then she said, that sounds great. So I did it yesterday, but I started working on it before this. So similar presentation to what I did with you guys today. And I, like, miracles just keep falling in my lap. Angels just keep looking out for me. I got a scholarship to a course creation, a digital course academy, which was $2,000. I don't know, you guys probably don't know about this, or maybe you do. I didn't before I was home all the time. There's all these master classes that you can take online all the time. And most of them are nonsense. Most of them are just selling their product or their course or whatever. And they don't give you good information. But the one I took did have good information, but it was $2,000. I'm like, I don't have $2,000. So I emailed her, and pre-COVID, Larissa would not have done this. I would not have, but I emailed and I said, do you have any financial assistance? Because I really want to take this class and I really don't have the money. And I got the scholarship, which was amazing because there were a lot of people in there. So I think just, and the inspiration was laying on the couch feeling like I was going to die and looking at my life. And then just, I keep getting ideas from other people about ways to expand it. My top 5 coping mechanisms in dealing with illness and anxiety is the next question. So we didn't number them down. Number 1, especially in this situation, in this pandemic, limit your media consumption. I think I told you that the word doom scrolling was it was introduced to me, and I did a lot of that. You know, as you know what you need to know to stay safe. You know what you need to know about it right now. Wear a mask, disinfect your hands, don't go around large groups of people, stay 6 feet away from people. And, you know, you don't have to watch the news and know that there's this many people that are infected today, whether it's purple or red or orange or whatever. I feel like there's a lot of COVID theater, like taking people's temperature, because many people don't have fevers, but we take temperatures to feel safer. And they did that at the nursing home every day, but it got in anyway. So all of that stuff. I mean, you don't have to watch Governor DeWine every week to know that you need to follow those things. So that's the number 1 coping mechanism, I would say. Number 2 is to do something like cuddle with the dogs or go for a walk by the, by the beach, by the lake. Maybe not now, but do things that help you to relax. Read books that you like that are not stressful. Do talk, share your story, share your fears. That's how you find your tribe. The tribe, that this is not even a good word to use. That's so what is it? This is not a good word, but it's this word we use. So if you find the people that relate to you. Once I started to share my own story, more people were like, hey, yeah, me too. And we can support each other. So I don't know if that's 5. I go to therapy, and I do art therapy too. I love art therapy if you ever get a chance to do it. I mean, I'm not artistic at all, but I love art therapy. It's amazing that the art therapist always finds a theme in your project, whatever it might be. So I recommend that. Doing something creative, doing a creative endeavor. You don't have to draw pictures. You could draw pictures. You don't have to write poems. You could write poems. One of the things I started to do is a gratitude journal. And I've started gratitude journals a million times, and maybe last for a week or 2, but really write down 3 things that you're grateful for, or even just think of the things that you're grateful for. They can be the same things every day. You don't have to search hard, but what is it about the day that was good? What made you smile that day? Write those things down. And I have started listening to more like calming music. I don't know if you guys like Leanne Rimes. She just came out with a new album. It's called The Human and the Holy or something. It is so, I'm about to look to see, make sure. It's called Chant, The Human and the Holy. And it's so calming. So if you have Spotify or Apple Music or something, you can access that. I recommend it. And I'm not like a super Leanne Rimes fan, but and I'm not a Leanne Rimes fan either, but I love this new album that she came out with. So does that answer your question? Does anybody else have any tips that they use to calm their anxiety that I didn't share?
One of the best things I think for anxiety is pulling weeds in the garden, which brings you right back to where you got started. And the garden's covered in snow right now, so that might not be the best strategy for right now. But all the things that you've suggested are really good things, and creative activities, walks, gratitude journals. And usually healthy food is at the top of my list, but if I can't smell or taste it, that would be harder.
Yeah, I really think once when I had COVID, I remember I had it early. It started in Ohio in March. I had it in May. So that's not the first cases, but it's pretty quick. And I was so ashamed and didn't want people to know. Once I felt comfortable to let people know, I think that really reduced my anxiety, because I was lucky that nobody was shaming or blaming me. And when I see people in a support group that mentioned the shaming and blaming, it's usually from a family member, or extended family member, like a in-law or someone that's like, it's your fault, you weren't careful, or you brought that around our kids. And yeah, but I didn't have that experience. So
That's amazing too, though. My brother had it, and I mean, I don't think that we would have ever thought to shame, ever. I mean, it was calling every day to check on him and see how he was, but that's amazing that that was a big part of it, or it is, can be a big part.
well, for me, nobody did that. It was
Right,
in
no,
my
right.
head. And my brother knew that I had it, and he was
Mhm.
very supportive and brought me CBD gummies.
Okay.
That didn't really help, because they weren't like the real thing. They were something he found at like a head shop or something. He was like, "Here, this might help."
Yeah.
So no, but when I see it in the support group, it's family members. It's my mother-in-law sent this text, or my sister said this, and just
Wow.
like, not at the time when you need that, right?
Exactly.
And it's so crazy, like, when did public health become a political issue? There's so much. I created this guide, and you'll see the guide I created for COVID-19 and mental health, but I created this guide for Thanksgiving, that I was gonna create something that, based on the class I've been in, the Digital Course Academy. I was gonna create a course on Thanksgiving rituals, which I still am, but it's a little late, but not for the public. So I had this guide to Thanksgiving about rituals and how the importance of ritual and gratitude and safer ways to celebrate Thanksgiving this year. And I bought some, unfortunately, because I really can't afford this nonsense, but I bought some Facebook ads for this guide. And I don't know what I'm doing, because I'm still new to marketing. And one of my friends said that the title isn't good, Larissa, but I liked it. So I stuck with it, which is called Thanksgiving in Trying Times. And I put this ad on Facebook, and people called me a fear monger in the comments. So I was like, maybe this is a bad idea. But it's just the way it is. It's a very sensitive subject for people.
Mm-hmm.
And some people don't believe it's real. They still
Right.
believe that it's a hoax, that the numbers are wrong. Or if we get a lot in the support group, well, only this many people die, we just need to all chance it and get it. But there's so much, as like I told you, now I know I'm overweight and the doctor's gonna use that as an excuse, but I have long-term effects from it.
Mm-hmm.
And even just not that, even if I didn't have to take all this medicine, hopefully someday my blood pressure will be stabilized without it. Hopefully I won't need to be on metformin or ever go to insulin, and hopefully that'll be okay. But just the experience of panicking on the couch for 2 weeks, I wish that on no one, right? Even if I didn't have some long-term effects, I'm healthy. I mean, the medicine is working, I'm doing okay, but I don't want anybody to have to go through that. Even, well, I mean, unless, you come out on the other side brighter and bubblier and ready to share your life and change and do exciting things. But I wish I had taken another route other than shaking and crying on the couch for 2 weeks. I don't want anybody to have to feel that way, because it's not pleasant. So the people that think, oh, we'll just all get it and have herd immunity it's a bad idea. Aside from the fact that it's going to overwhelm the hospitals, and
Mm-hmm.
if we get in a car accident or fall in the snow or hurt ourselves pulling weeds, we're gonna have to go there, and there's not going to be anybody to take care of us. And the nurses and doctors and the stress on the healthcare system, and the
Mhm.
healthcare providers, the witnessing people dying,
Every day, yes.
it's not good for
No.
us. Okay, I'm off my soapbox. Someone asked, can I share how people can attend my support group? So it's a little bit different. It's not my support group. It's a group on Facebook. So if you're on Facebook, there's a group. There's actually lots of them. The one that I am a moderator for, there's an admin who actually started it not for COVID survivors, but when COVID first came out, for small businesses. So it's the COVID-19 support group, but it has morphed into, there's 21,000 people in it. It's not like we have meetings
Wow.
in support group in that way, but people post about their experience. They post about their family members. They post all different kinds of things. Some people try to scam people for money. That's mostly what my volunteer job in the stuff was, to like delete the people that are like, collect your $500, and then they're gonna like get access to your bank account or something. So we try to keep it a safe place. We try to keep politics out of it, but politics is all in public health right now. So that becomes challenging. There end up being fights about Trump and Biden and masks and no masks. And we try to limit those, because there are people in the group that have lost their loved ones, and people in the group that a lot of people come into it when they lost their sense of smell and now they're worried or whatever. So it's just a group on Facebook. If you're on Facebook and you're interested in looking at it, you don't have to have a COVID-19 diagnosis to be part of the group. It's the COVID-19 support group. And the picture on the heading is like a sunrise or something. So there's several of them. There's a bigger group called Survivor Corps, which has like 1 million people in it. And that the person that runs that is in the media a lot. She was a survivor very early and donates plasma. That's another thing that I do that helps me, is donate my plasma. It makes me feel good. Mm-hmm. So I don't know.
Did anybody else have any questions?
I'd like to thank you for sharing.
Thank
Irene,
you.
you beat me to
Excellent
it.
story.
Thank you. I hope I met all the objectives.
Yeah, and are you taking on paid clients? Yes,
I do. I am. You can. I don't know. I'm not here to advertise my business, but
I know.
if you search my name, it'll come up. I take most insurance except for Aetna, because they denied me. They said they had too many in their. They had too many providers with my specialty. So I'm gonna.
Oh, in their network or whatever. Yeah. Okay.
But I haven't had anybody with Aetna ask. But I take most of the rest of them.
Okay.
Thank you so much for sharing, Larissa. Thank you all so much for joining us this evening. We really appreciate your time. I want to one more time beg for you to fill out the evaluation so that we can continue to offer this type of programming to the community. We really appreciate you and hope you enjoy the rest of your evening.
Good night.
Thank you. Great job. Thank you.
Thank you.